So just as a reminder, Torms's paper was about Turkey, and she talked about fear as a tool in management of the lockdowns, and the class impact, a perspective and interest prevailing over political divisions even in lockdown management. Nicolas talked about Angola and how school closures were impacted by the inefficiency of the government, poverty rates, but also a corrupt and ineffective government policies, and how what was expected to work on paper did not work. In effect, Alejandro's paper is about Bolivia and about the heterogeneous impact of the policies on different kinds of populations, and how more stringent policies in the lockdown did not lead to better outcomes in terms of fatality. So I'd like to open the floor to questions and short comments.
All right, thank you very much. Pretty interesting session, really. One of the things I want us to explore is how you feel around, and that question is to Thomas. You played a very important role. What was in your mind when the issues around the decision to close school due to the COVID, how it came, how did you see it? Because in some other places we saw vaccination of children, and does the epidemiology direct that? So in Turkey, when the school was targeted, I'm sure it was a junior school, if I had that, the closure.
Can we collect a few questions in?
Okay.
Yeah.
Okay, so I just wanted to know what was in your mind when you were doing those. But it was quite a great, resistance that you pulled through. The other one was is to Alejandra. I was looking at the correlation in Bolivia, between the lockdown. You didn't see any outcome. I wanted to know, quite interesting, the qualitative information around that. Whether you were able to gather some qualitative data and how those could be explained. Thank you.
Thank you. This question is for Tomaris. Your comment about left-wing authoritarianism is certainly something that I've witnessed in the United States around school closures in particular. And I was wondering, in the context of Turkey, where the left is currently in terms of reflecting on pandemic policies in general, right? Has there been sort of an acceptance that, we went too far, what happened?
No.
And some sort of process of a reflection, or has it created a new culture of safetyism or longing for, heavy-handed state intervention? Or what do you think the legacy of that is going to be? Thank you.
Well, no, actually, it was a question for all the speakers. In a way, how are children now in your context? And in the context of Alejandro, which wasn't so much about education, but, the impact on social welfare, how has that been?
Yes, I have a question about Turkey as well. I would be very interested to know, in your perception, how, considering the big percentage of immigration you have, refugees from Syria particularly, I would be interested to know how the situation in the refugee children, compares to the rest of the population. Thank you.
I have a question towards Bolivia and the presentation. Could you please elaborate again on that point, what it means when that there was a certain amount of days lost per person? Can you expand on that in terms of understanding what that entails with regards to welfare? Thank you.
Okay, can we start with you, Thomas?
Okay, I'll answer a few and then leave some of them to other rounds, if possible, and also one to you. The first question was about how I perceived the school closures, I think. So I'm living in the Netherlands, and Netherlands is one of the countries who closed down schools least for under 12 years old. So the primary education was very, very minimally disrupted. And that's also one of the reasons why I went into this. Because my children, I have 3 kids, they were enjoying school and they were enjoying life. And 18 million the children and young people in Turkey were not. And I could see, and everyone was, well, we went into a big campaign, and Gül is going to talk about it. And one of the biggest reactions to me were, because I became the public figure of this campaign, and one of the biggest reactions to me were like, it's easy for you to say it. I mean, the conditions in the Netherlands are so high. I think they were imagining like space shuttle, clean environments in schools. And I was like, my children are in classes of 30, and there's no mask. And there's a 60-year-old teacher who is opening the windows manually, which is quite laborsome because she needs to climb up on a chair to open and close down the windows. So there's no certain air conditioning or so, or HEPA filters or whatever. So it took us months and months and months to tell that. And I tried to make a case that it is possible. There are several countries doing that, and why not we do it? And if it's because the classes are too crowded, and that's the case, then make them half and half. So then half of the class comes 2 days a week, and the other half 2 days a week. So there are ways to do this. So my first feeling was really filled with anger towards the unfair situation. Of what's happening in Turkey. Another thing with this left-wing authoritarianism and the legacy at this moment. So again, Gül is going to tell more about our campaign, but what we did was to prepare reports, really scientifically driven reports, early at the end of 2020 and at the end of 2020 and beginning of 2021, we did quite a campaign in that winter and the spring, we mobilized the key actors and really respected scientific actors. Wasn't easy though, like Turkish Medical Association, and what we could see was that the discourse in Turkey and USA was quite similar for a long time. But after, I think, the summer 2021, what we saw was that the discourse in Turkey shifted and moved away from the one in the USA, because the winter 2021, it was still the autumn 2021, and there were still discussions about like keeping school closed, or there were sort of no remorse in a way, whereas the Turkey already shifted, and all those actors already defended school openings. Well, in the beginning they defended school closures, but they changed their narrative after a while. And
well, I think you can be open about that.
Well, we worked very hard to change that narrative, and what we could see was that the arguments we built, the sentences we made in our reports, they all started coming up in mainstream after quite a time and investment in the public campaign. So we saw that this shifted the discourse in Turkey earlier than the USA. So in a way, they did that reflection during our campaign with us, in a way, by changing their position. But there was no clear.
But may I add one thing here? Yes, I want to add one thing here. We had to convince one person in the end. It was the president of the Medical Association of Turkey. And when she said yes to us, and then she said, talk about this, we're behind you. And that moment changed everything, because Medical Association of Turkey is a very well-respected, socialist-leaning organization. All the left took its cues from them during the pandemic. And when they said, we'll open the schools, let's open the schools, that's when the left moved, and the right didn't. But that didn't matter. The opposition started talking about it, and high-status socioeconomic groups started shifting in in the other direction. And we then really separate from the states, which is still close the schools. Like, that mindset didn't change much.
Yeah, but after even convincing the president of the Turkish Medical Association, it took months to
Yeah,
transform the
yeah.
discourse in the organization and have an influence on leftist teachers' union, because then there's an alliance between these leftist groups. And then once you because it's a health matter, the leadership was in Turkish Medical Association, and through that, then it started having an impact, and it took months, actually, still.
And one more sentence. I mean, left-wing, I criticize the left wing all the time in Turkey because of this. However, when we talked to them, they listened. And it was them that were open to this rhetoric, because you just need to remind poor kids. And once you remind, and once you say, this is not about your kids, this is about poor kids, it was fertile ground. They were, okay, like, I'm a socialist, I'm a leftist, I'll think about this. When we went to more neoliberal, right-wing people, we didn't get a response from them, for example. That was a really different matter. Gender was so critical. We talked to women. It just changed everything. We talked to women, we talked to them about their children. Yeah. Alejandro, please.
I don't know which question to respond first, but I think I'm gonna combine your two questions because both of them are related to like the methodology or how like the interpretation of the results. So what we have done in the paper is to first estimate the reduction of mobility and try to see its impact in welfare. And we have defined welfare in two ways: the excess deaths and life quality. Excess death was considered like how more deaths compared to like the average in previous year more we had because of COVID. And life quality was was measured kind of like it was like correlated with this reduction of mobility. So the more mobility, the less quality of life you had, because you kind of like lose the freedom to go outdoors and I don't know, go to restaurants, have education. So in terms of the first conclusion was that a negative correlation. It's that this so the reduction of mobility didn't really help it to improve these excess deaths that we have. And in terms of the days lost, so as we have been using that, for example, in the case of the excess deaths, we try to measure it with the first year's loss. So if a person that died I don't know, at its 70 years, didn't have so much years lost compared to a person that if that person would have died at 20. If a person that dies at a younger stage of their life would have like more years lost. So we converted that into days lost. That's kind of like the interpretation we have done. And so when we have in the study in terms of countries, we found that negative correlation, but in the state one, it wasn't possible. One of the things that I think it's because of that change of policies in Bolivia, going from super very restrictive ones to not restrictive ones. Mm-hmm.
Well, what are kids doing now? The impact has been very high. In particular, the school dropouts are very heavy. One of the problems is that the data on school dropouts are not clear, and this is one of the strategies of the current government. They find ways not to share the data. So what they did was to make open high schools, so remote high schools in a way. So you can be in education, but it's not actually an education. You just get lessons from like Open University, you get it online or whatever, but actually you're not getting it. But it practically means that you're out of education system, but because you're enrolled in that the remote education, that you seem to be in education system, or you're enrolled but you're not following the courses, you still seem like in the education system. Even with that, I think there's about a 1.5 million dropout from schools, but it's probably much worse if you count this open high school thing, and also if you count those who are enrolled but not following any courses actually in reality. So that's the situation. And with refugees, do you want to help on that?
Shortly, we have zero data on refugee children in Turkey. The government is purposely, we don't even know how many refugees live in Turkey right now because it's the most politically divisive issue, and all information is being hidden. So the government says there are 4.5 million refugees. Most people believe there are 8 to 9 million. Some people argue it's 50 million, which I think is no. So we actually don't know. But it's easy to guess it's been terrible for them because they already didn't speak Turkish. So if anything, it must have affected them way worse. We could not talk about that in our campaign. Whenever we brought up refugee children, people actually lost sympathy. Yeah, that's unfortunate. I want to ask Nicolas, because the question was for the whole panel, how are the children on Angola affected post-pandemic?
Angola is a securitized country, and then Angola lacks the national assessment system. So monitoring and then evaluation is something that does not even exist. So that's very significant to the question because there's no statistics, valuable statistics data that can, account to what really happened, transpired in terms of numbers with the, marginalization of children, except the UNICEF, studies that I use in my paper. But we know that marginalization is still ongoing. Children from poor family, where they're more affected, women and children, they're more affected because Angola, the basic services are even, a big problem because electricity is poor, and access to online education is something that is a mirage to, thousands, millions of Angolans because if for you to have online education, you need to have internet-capable devices. Although, phones are popular in Angola, but the internet capability is a problem, and where there's internet, people don't have electricity. So these are, by themselves problems that affect, children and women. And Angola is a very divisive country, an equal country where 2% of individuals, have it all, and in the rest, overwhelming majority of the population have nothing. So those of us who are in the privileged position have access to internet, but the rest of the people don't. So unfortunately, that's the scenario. So, and the reason for that being, as I mentioned earlier, Angola lacks a very sound, statistical system. There's no data because the government uses the data to kind of, frame the narratives, the public discourse in terms of what, is happening and what has happened during the COVID pandemic. So, and I'm saying this because I'm here, because if I'd said, I would not have said this if I were in Angola, by the way. I'm talking to you and saying this because I'm in the US, so I can say this. Because if I say this in Angola and the next day I might find myself in jail, or even lose my job, if you will. So, unfortunately, that's the situation, and children still suffer and will continue to suffer until probably there's going to be a new government, or I don't know what it is. But with the government in place, we still have difficulties because, as I said earlier, policy making today is, research based. You have to have sound data that, backs up what we do. But in Angola, research-based policy is still, a far-fetched situation because the government controls everything. It's overly centralized system. So although at the level of political discourse, they might say that, yeah, we are open, we are democratic, but whatever that might mean, the different things, democracy might mean different things to different people in different contexts. But in the Angolan context, it's a very drastic situation, and where you cannot even speak about it openly. And later on, as a scholar, I mean, even if you're a scholar and you are controlled by the government, and if you say what I just said, you are on the verge of losing your job.
Thank
I think
you.
that's my contribution. Thank you.
Thank you. We have one more question.
Okay. I found all the presentations very interesting. Turkey is so similar to some of our experiences on this. In Bolivia, I had reflecting actually on my Indian experience rather than yours, but still want to know how it went for you. You gave figures about excess mortality, which is one of the highest. What is the official government's acceptance of those figures? Are they accepting it? Are they pushing back? Are they saying those figures are believable? Or is there some agreement of compromise on that? Second question is there a relationship? Do you have any understanding in this excess mortality? What proportion of mortality is directly COVID 19 and what is due to non COVID 19, which is perhaps also exacerbated during lockdowns? So, in some sense, when you're talking of what is the proportion? Do you have any estimate of this? Because you have more data than many of us can ever present, and you have it by province and district. The third is your strictness of law. When you say mobility, are you meaning all the lockdown restraints, or are you talking only of transport and mobility in that sense? What are you really meaning by the term mobility? Because most of your graphs are against mobility on one axis. So what is that mobility that you are referring to, and what is the measure of it? Is it the Oxford University is very qualitative, impressionistic measure? They make a phone call, they get a response, and they put it down as the truth. I mean, what governments intend
Also
to.
very critical towards that measure.
Oh, I don't know. There was some, as I say, because governments, what they intend to do and say they do, and what actually happens on the ground is entirely different things. So, huh?
We didn't invite anybody from
So, because if you actually say that we have asked all things, but people are going around and doing that. So, in some sense, what is your measure of that? So, actually, this is good data, but I just want to be a bit cautious because, as I was saying in the morning, I've almost seen none. So, this is.
Thank you so much for your questions. So for the first one, yeah, actually, I remember that there was one gathering when we presented these results, and of course, we received a lot of critiques because the government thought that they were overvalued. I mean, it was overestimated. Well, it's the data we have. Of course, the data also can also have many bias in the measures, and especially when it's like, and this is maybe related to your second question. I'm an economist, so it's very hard to give causality. So to say this mortality was because of COVID, it could be because like COVID pushed that person or make the person's situation worse. So it's really hard to say it was because of COVID. But
I'm a medical person, not an economist.
okay. So in the Bolivian context, as I know, if the person was hospitalized and had was positive of COVID, the cause of the death was because of COVID. So that's like how the data might work. And related to your third question.
You don't have the proportion.
No, it's hard to say. Yeah. And related to your third question, yeah, I think I might be, I maybe kind of like confuse you. I used two measurements, the stringency COVID index and the mobility one. For the study that I presented with the bubbles and all the mobility thing, we didn't use that data. We used the Google, it's data from Google that uses the mobility of people because of Google Maps. Yeah, there are some critiques about that because in Bolivia, not all the people, for example, have access to. Yeah, exactly. Or yeah, but it was a way that we tried to measure that loss of mobility. Yeah. Thank you to you.
Thank you. Any comment from our?
Perhaps I can add something, because, well, I hear a lot about the educational technologies also, like that they are not being available in low-income contexts. But when it comes to younger children, especially primary school education, I really suspect, even if there was technologies available, even if there are tablets or computers available, I'm not sure if it could ever replace the face-to-face education. So, if we could or should be prepared for emergency remote education in any case for this age group. Because, I mean, what happened there are different concepts actually. On the one hand side, there is this emergency remote education. So in terms of disruptions, like big things happening, that for a short time you move to remote education, so that you don't lose the children in a way. But then there's also the sustained online education. So in the case of, the younger the children are, the more meaningless online education is, I think. If there are any parents in this room, they would probably acknowledge that.
Well, now we have data too.
So absence of technology is sometimes, I hear my colleagues like, yeah, absence of technology, that's a problem. But even if there was technology, even if you are the richest society or the country, for primary school, online education is, in my opinion, is really not an option. So that's one of the things. And for even secondary education, high school, I would leave a question mark there. And several of you are academics here. Think about your experience with remote education or online education during with university students. Could you keep them engaged in education with remote only methods for weeks or months if you didn't see them face to face for a long time? I just wanted to put that point in that being, on the contrary, the more having not having the means or it should not be it's not the problem when it comes to younger education. Younger years of education.
So I think our report made the point that education is not just about learning formulas, it's about socializing with your friends. And going to work is not just about making money, it also has a very big socialization status, all kinds of components. And we don't talk about these things. But we are out of time. It's 15 past. Thank you for the wonderful questions and these three amazing presentations. It's time for a break.
Thank you, Aysida.
Thank you.